I'm Dr. Arshnoor from Dr. Arshnoor's OET Institute. In the series of the role plays, today's topic is for the nurses and the setting is community health center. Here the patient has come to get advice regarding smoking cessation program. So nurses, for you, it's important that when you're going to start with this topic, first introduce yourself, then welcome the patient. And you may start the topic by saying, how may I help you? Then the patient will tell about that I have come to get advice regarding your smoking cessation program. Then you have to ask the patient, can you please elaborate it a bit more to me that why do you want to quit smoking and what have you planned? Then the patient will explain that I have failed multiple times to try cease smoking and that is the reason I have come to get information regarding the support group run by your organization for the patients who wish to give up smoking. Now, this is your task to ask certain questions from the patient. You may start with, how old are you? Then, yes, one thing very important. You may ask the name of the patient during the 3 minutes preparation time. Otherwise, this patient's name can be asked at this time also. You can ask, how would you like to be addressed or how may I call you? Or for the better conversation, I would like to know about your name. How would you like to be addressed? The patient may say that my name is Michael. Then you may start with this name. Michael, I want to know more about you. That for how long have you been smoking? The patient will say that it's for the last 20 years. Usually, this is uh, the topic that the patient want to quit smoking after the period of 15 to 20 years. So I have considered as he's 40 years old and I'm considering that it should be 20 years old, 20 years that he has been smoking. This time, it is not important to give the information directly or to give advice directly. You can just keep on writing all the details of the patient. At the end, you have to rephrase and then answer the questions of the patient. Now, the next part is find out how much as possible patient smoking habit, daily consumption. Then, yes, you should get the rest of the information that how many cigarettes do you smoke every day? In such cases, the patients are in a habit of smoking 15 to 30 cigarettes, or sometimes I've seen the patient with the 40 cigarettes per day. You just have to give your expression, oh, it's too much. If the patient says that I'm smoking 25 cigarettes per day, simply say that it's too much. Patient will say, yes, I do know. That's the reason I've come to get the solution for this problem. Then the next is, we have already told that for how long has been smoking. Now you should ask the reason why do you want to quit smoking. In some of the role plays, it is mentioned that the patient is a female and either she has become pregnant or she wants to quit smoking due to her children. It may be a father that he became father recently and he want that his children should not be affected by his smoking habit, as is the known fact that it is not only the active smokers, but the passive smokers are also at the equal risk. So then you have to admire or appreciate the patient's concern or the decision by saying, I really appreciate for your concern that you want to quit smoking for the sake of your child. Yes, it is right. That is not only the active smokers, but the passive smokers are also at the equal risk. So it is a very good decision of yours, Mr. Michael. And then you may proceed further by giving the particular treatment solutions. As in some of the cases, you may say that whensoever you have the urge of smoking, sorry, whenever you have the urge of smoking at that time, you may take nicotine gums, nicotine patches, or electronic cigarette. Here it is given that Champix tablets reduce cravings, block rewarding effects of the cigarettes. Other suggestions can be nicotine patches, gums, or hypnosis. Online support groups, these are some of the solutions. Fine. So there are other solutions for you, Mr. Michael. You may start with some activities like joining some groups, which will be quite helpful for you to remain busy. Whensoever you have urge of smoking, at that time, you can either use electronic cigarette solution for this, as I won't suggest you to go for nicotine addiction because it's quite harmful and it has lots of hazards. As the people who are continuously smoking, they are prone to lung cancer, chest problems, and many other harmful effects. So hope you don't want to have such serious effects on your body. So that's the reason I really appreciate, or it's a commendable job of yours to come to the clinic and get the solution for your problem of smoking, continuous smoking. Yes. Now, what is another harmful effects of smoking? These are diseases like asthma. It is upper respiratory tract infection or problem. It is asthma is a problem where continuous coughing is and breathing difficulty is there. Shortness of breath can be there. Cardiovascular diseases could be there. Or the worst part is the cancer, as I already explained you that lung cancer is the most common cancer among the smokers or the cigarette smokers. Then it can be recommend making a plan together, help the patient to identify triggers, reward, and benefits. Yes. As being a nurse working in the center or the sport group, where you are organizing or you are helping the people who want to quit smoking, you have to give the proper plan to the patient that first of all, I would like to know about the triggering factors. When do you smoke? When do you have the urge of smoking? Is there any triggering factor here? It might be that when you are lonely, maybe when you are too much stressed, or even a habit, or you may ask that if something is pressurizing you to smoke, then the patient may say that it is over burden of my work. It may be that due to stress, it may be the isolation, or it may be anything. Then you have to tell the patient that first of all, motivate yourself, because smoking cessation is not an easy task. Patient often start with this and after that they leave in between because their motivation is very weak. And as I've already told that in this case, the patient has told that he want to quit smoking for the children. For this is a very strong reason for the patient. So you may tell the patient that whensoever you have urge of smoking, just think upon your child that you don't want to harm them. And in this way, you will be motivated and you may use e-cigarette, nicotine gums and nicotine patches, which can be quite helpful for you at that time. Then when you stay without smoking for a certain period, must reward yourself. It might be that you give yourself, you buy something for yourself, or you may spend that time with your children to enjoy their company, or anything which keeps you happy. You can do that activity at that time, but it should be some positive activity. It should not be like that you quit smoking and you start drinking. So it should be something which is beneficial, which should be productive for you and your family. Then example, otherwise they have given some example like more money, fewer health problems, and yes, this is actually the rewards which will be getting. So Michael, if you quit smoking, how many benefits you will be getting? First of all, you will be getting your money saved. The money which you are spending on buying cigarettes, that will be saved. Secondly, you will be closer to your family as you're thinking upon your family. Due to that, you have planned to quit smoking. And the most important is there will be fewer health problems. As I've already explained that there's serious health hazards like cancers, especially the lung cancer, asthma, and other myocardial infarction could be there, cardiovascular disease can be there. You will be safe to much extent from these diseases if you quit smoking. These are some of the benefits you will get after quitting smoking. And help fix a day to give up. If you are determined, then you have to fix a date. Suppose you want to quit smoking, it cannot be done immediately. There should be a date which you feel that you will be able to do or quit till that date. You have to make your firm decision for this. You may give more time, like 2 months, 3 months, 4 months. In this case, if you're smoking 20 cigarettes per day, it should be reduced to half in the first month, that is 10 cigarettes per day. Then by reducing it to half, then half to half, and then after that, quitting smoking immediately. You may give 2 months, 3 months as per your strong determination, because that is very much required here. At the end, you should say that I agree to offer ongoing health and support. Then, after having conversation with you, Mr. Michael, I am totally convinced, and I feel that you can be able to fulfill your wish to quit smoking in the period of 3 months. And I'm going to fill your form so that I should enroll in your sport group, and you should be benefit from the program of quitting smoking run by our organization. You're welcome to our program. In this way, you can end up the topic, and hope this role play will be helpful for you to get certain ideas regarding smoking cessation program. And if you like my videos, do not forget to share it with your friends and press the like button. And if you have not subscribed our channel yet, subscribe it right now so that you should be getting the latest information on our channel whenever we are uploading any new video. Thanks for watching. Stay connected. Happy learning.